Joining me now, live here, it's good to meet you.
Great to meet you.
Dr. Peter McCullough with us. Joining me, Dr. Peter McCullough live. I want to start with this week's conference that you were at, featuring Senator Ron Johnson, Dr. Malone, who's going to be with us a little bit later, and yourself. What went down there, Doctor?
Well, I tell you, Senator Ron Johnson, a real American hero, gave a great opening speech. We're at the unit of Hillsdale in Washington, D.C. The American Conservative hosted. You know, Eventbrite actually worked to sabotage the meeting. They tried to prevent people from going. We had key media people, other community leaders. We went over a deep dive in about an hour and a half on vaccine safety and lack of efficacy.
Tell me about, let's start with the lack of efficacy, and what I believe that this is one of the greatest cover-ups in history, because people are dropping dead all over the place. They're just healthy people, and they're getting these blood clots. Somebody told me a story the other day of somebody that went to a hospital because he had a very pain in his leg, and his doctor says, you better check in, there's something here now, right? And they called it, they went and checked in, they looked at it, they called it the Pfizer clot, gave him blood thinner, and told him, this is a friend of mine, this is just a true story, told him if he hadn't come in that day, within 48 hours he'd have been dead with a heart attack. And they called it, the RN called it the Pfizer clot. Why isn't any of this out there?
There are large numbers now of injuries. The United States, we're well past 1 million injuries, and well past 1,000 peer-reviewed papers in the medical literature. Everyone agrees, the regulatory agencies, the scientists, these vaccines, because they produce the spike protein, cause blood clots, they cause heart damage, they cause brain damage, and they create bone marrow immunologic problems.
Unbelievable. Why isn't any of this made public? Why are they either covering up, ignoring it, whatever you want to say, it's not out there in the public sphere?
I think you're right. I think cover-up is the right word. When the Pfizer dossier was released, Pfizer knew about 1,223 deaths within 90 days of release of their vaccine. You know, after a handful of deaths, they should have stopped. They should have done an investigation, as we would with any drug. Because these were pre-purchased, the government was completely committed to this. All the agencies, CDC, NIH, FDA, HHS, 100% committed behind getting a needle in every arm. No one could stop this freight train.
So what is your advice to people now? What are your concerns about vax injury risk, and how can people determine if they might have been affected by it?
Well, we've had no research. The CDC and FDA were supposed to do monthly safety reports. They've done no safety reports. So we still have a difficulty figuring out who's at risk for these problems. I can tell you this much as a doctor, and this is using my clinical judgment, anybody with any heart problem would have worse consequences if they develop myocarditis or heart injury. People have already had a blood clot. Those who are predisposed to blood clots, heavier individuals, those with poor circulation, those with blood clotting disorders, it's going to be a disaster to take one of these vaccines because we know they cause blood clots. Those who have underlying neurologic conditions, Parkinson's, multiple sclerosis, neuropathies, taking a vaccine on top of this is going to make it worse. You know, it's a good example of that. Eric Clapton. Eric was in town last year, reached out to me, said, listen, I had a peripheral neuropathy. I took one of these vaccines. I can't even play my guitar. He couldn't even play for over a year.
So what is the antidote? So let's say you've been vaxxed, and now you're concerned about an injury or a ramification. What are some of the symptoms that say, maybe I should see a doctor?
You know, everybody should be paying attention to how they feel before they take one of these vaccines. And if they take the risk now, they need to pay attention to pain or discomfort or swelling in any one of the limbs. I've seen blood clots that occur in the arm now, which is very, very rare. Any new neurologic symptom, dizziness, difficulty walking, difficulty seeing or talking, or cases of blindness, cortical and ocular blindness, and very importantly, any chest pain, difficulty breathing, or effort intolerance. That's a broad array of symptoms, but there are thousands of people now who are developing them, and we have little chance to save patients. Do you know, in the fatal cases of myocarditis reported by Gill and colleagues in Archives of Pathology, 2 young boys, aged 16 and 17, they died at home after days 3 and 4 after Pfizer. The parents never had a chance to do CPR or call 911.
Spike protein is one of the most toxic things out there, and that's been used in the vaccines. Has any of that been flushed out?
There are now thousands of papers on the spike protein. It's 1,200 amino acids long, about 12 glycosylation chains. It is actually coded for in Pfizer, Moderna, Johnson & Johnson, AstraZeneca. It's actually given in a limited form in the Novavax vaccine. It's in the Chinese Sinopharm vaccine as part of the killed virus. The spike protein was manipulated in the Wuhan Institute of Virology. Papers by Ralph Barrick and Vineet Menachery from the University of North Carolina, Chapel Hill. It was U.S. funding that devised the spike protein and made it more infectious and more lethal. And they did the experiments. The two papers they published in 2015, the title of the paper this is a U.S. institution where the work was done in China. The title of the paper was The Emergence of SARS-CoV-2 into Human Populations. This is in the open. This is a government operation. There was a research operation trying to plan for the next threat and plan for the answer because they're working on the vaccine at the same time. But it went bad when it leaked out of the lab.
Unbelievable. What about Biden now? He can't seem to test negative. He's had all the booster 8 shots and now he can't test negative. What is actually going on with that?
There are 3 false claims in the vaccine program. 1, that it would stop infection. Didn't do that. 2, that it would stop transmission. Our CDC director came out earlier and said it doesn't stop transmission, so people are just as infectious. And then the 3rd one is that the vaccines were going to make the cases milder or reduce hospitalization and death. Never shown in a randomized trial with that as a primary endpoint. No real valid observational study showing that. And now to make matters worse, Biden gets COVID, and instead of getting community standard of care, which we use a combination of drugs and sequence, which I pioneered and published, we never use one drug to treat this illness in a senior citizen. He gets monotherapy of Paxlovid, which is not supposed to be used in people who have taken the vaccine. The CDC warns against doing this, and then he gets Paxlovid rebound. He gets better for a little while, then he gets it again, and more importantly, he actually has now had a prolonged illness, and he's been more infectious for a longer period of time. If he would have gotten, let's say, monoclonal antibodies or a hydroxychloroquine or ivermectin-based approach with other drugs, he would have been over it. Do you know my mom, who's a little bit older than him, had it at the same time? She was done in 5 days, and now he's going on a month.
And they continue to lie about this, which is the most incredible thing. Dr. McCullough, give us an update on what the authorities are trying to do to silence you, strip you of your board certification, and how are you fighting back?
Believe it or not, there are laws that are being formed, one in California, thankfully I don't practice there, that would prohibit me from doing this, prohibit me from having free speech and giving my analysis.
Like coming on my show? Coming
on a show, I would actually be violating a California law.
So your free speech would just be shut down.
Right. And there are now, believe it or not, there are now through every major society, medical society, through HHS, now the AMA, the American Board of Internal Medicine, and all the agencies, wording that's gone into their mission statement using the term misinformation. I can tell you as a doctor, there is no misinformation or information. There's just scientific data, and we interpret it. And so the idea that somebody has license over the truth, someone actually has control over the truth, that is preposterous. We're all searching for the truth, and it's by this type of interchange is how we get there.
Where do we go from here?
I can tell you at this point in time, the vaccine mandate should be dropped immediately. The program, the vaccine should be pulled. The World Council for Health, worldwide organizations call for global recall of the vaccines. And the best way for this to happen is for Americans to defer and say, listen, I'm not going to take any more.
You're done. You know, it's interesting. You go to baseball. I'm a baseball fan. You know that I follow that. And you got a number of teams now. The Toronto Blue Jays playing in Canada. It's very restrictive to get to Canada. You have to be vaxxed. And so they have actually, the Blue Jays fighting for a playoff spot, have an enormous advantage right now because there's a number of teams that when they have to go to Toronto, they go on the road, some of their players will not get vaxxed, so they can't get into the country. So they're bringing up, other, minor leaguers or farm players in order to fill out the roster that have been vaxxed. But it's giving the Blue Jays this huge advantage at home because half the teams, almost everybody that goes in there has a number of players not vaxxed that can't get in and play them on the road. So people are still, starting to see this. Dr. Peter McCullough, I really want to thank you for all you've done. People want to follow you, get in touch with you on social media. Where do they go?
I have a link tree, petermcculloughmd.com. That'll take you everywhere. About 2.5 million people access my Twitter each day. Twitter is automatically unfollowing people off my account, P_McCulloughMD. Follow me and stick with me.